Today we're talking about cervical and lumbar stenosis. So the diagnosis sounds very, very scary, and most people don't even know what it means. And the scarier part is that sometimes when you go to the doctor and he takes an x-ray and you're given this diagnosis, it's accompanied by verbiage from your medical professional, something along the lines of, oh, this is the worst case I've ever seen. It's bone on bone. I can't believe you're still walking, or you could still move your neck with it being this bad. Oh my God. And it's just puts people in this fear mindset, and it needs to stop. So today we're talking about what this diagnosis means, what the prognosis is, and what you can do to help it. Welcome to Fearless Fridays, where we're talking about everything health and wellness related. My name is Dr. Melissa Chofi. I'm the owner of New Quest Physical Therapy, serving areas in New York and Connecticut. There is so much misinformation out there in regard to the medical field, and with our healthcare model turning more profit-driven, you guys as consumers need to be given all the tools you need to ask the important questions and demand you're getting what you need to ensure a strong, happy, fulfilled, and fearless life. My goal is to empower all of you to stand up for yourselves and be able to call bullshit in a realm that is confusing as fuck. Let's get into the episode. So stenosis is very, very common. Basically what it is, it's arthritis in your spine. That's all it is. And it can be seen in people as young as 19 years old. So if you're above the age of 20, this video is probably an important one for you to watch. So people can have stenosis and not even realize it. You walk around, you have no pain, you're flexible as shit, you're working out, and that's fine. Nothing, if you're at that point, your stenosis is not limiting you from doing anything. It's not a danger to you, and it's really not something that you need to be worried about. What you need to be aware of are ways to prevent the progression and prevent that pain and weakness and whatever that may accompany it in the future. Prevent it from happening now by doing stuff. And we'll get into that later on what you can do. So like I said, stenosis is arthritis in the neck and spine. Neck being cervical, lumbar being lower back. So what happens is your whole spine is made up of joints, pretty much. So you have a segment of vertebrae, you have a disc, and then you have the neck segment here. With stenosis, what happens is that disc, just because of normal wear and tear, nutrition to the disc itself, the disc tends to shrink, and what happens is those vertebrae start to approximate, so they get close together. Complications from this can arise, being that nerves travel between those vertebrae and supply your arms and your legs, and those nerves can be compressed, and that's where numbness, tingling, if you've heard of sciatica, that's where sciatica can come from. So those are things that we need to be aware of that are potential problems. But just because you're diagnosed with stenosis and you're showing arthritis on your spine on an MRI, a CT scan, or an X-ray, it doesn't mean that you are destined for that nerve problem, that numbness, that tingling, shooting pain. You're not destined for any of that. So don't believe into the bullshit. So one thing that I see a lot of, or hear a lot of with my clients that come into the clinic, is that they're told that their arthritis, stenosis, whatever you want to call it, is going to get worse as they get older. So they might as well get an injection now. They might as well get a surgery now. And that is all a load of bullshit. Nobody has a crystal ball. Nobody can tell you what's going to happen in 30 years. So if you're not having any complications, if you're not having any pain, you're not having any of those nerve symptoms I talked about earlier, there's really no reason to do anything as invasive as injections and surgery. And yes, injections are invasive. Cortisone injections have been recently proven to deteriorate the joint itself, which is what we're trying to stay away from. So anything that's invasive like that you're putting into your body, you want to stay away from, and you want to be able to make your body resilient as possible to avoid these unnecessary procedures. So those of you who know me know that I am not an advocate for surgery unless it's absolutely, absolutely warranted. And in the case with spinal stuff, it's like if you start having if you've exhausted every single conservative measure, including physical therapy, and you're actually going to a good physical therapist, if you've actually been doing your homework, you're trying to stay active, and something severe happens, like either a traumatic event or one morning you wake up and you absolutely can't walk, then surgery might be warranted. You also, if surgery is to be considered, you want to get that second opinion with somebody who is honest, not somebody who just wants to cut you open for the sake of cutting you open. I actually, not that I'm not toting that I'm the best PT in the world, but I had a patient a couple of years ago who he had what we called a lateral shift. So he was like this. This is how he presented because he had such intense pain going down his left leg. And they wanted to do surgery on him. We had intense physical therapy, and we avoided surgery. So, side note, surgery is not always the option for stenosis because it doesn't fix the cause of why your spine is the way it is. It fixes a structural deformity, but why did your neck or your back get to that point? What are the muscles doing? What does their function look like? What is your spine able to accomplish when under a load? So every day we're being loaded just with gravity, with walking, with climbing stairs, and all of that. So surgery is a passive fix, which usually doesn't fix anything. Surgery for stenosis is a passive fix, but you're not addressing the underlying issue, which is the fact that your body cannot take on a progressive load as you're going through everyday life. So that's what your real problem entails, is being able to find what your body is capable of and how you are going to load it and strength train and move and just basically like rehabilitate, for lack of a better word, to be able to avoid complications that may arise down the line. And the complications don't arise from the arthritis itself. They arise from the moving parts that are around that arthritis. So joints are comprised of muscles, ligaments, tendons, all of that affects a joint. They don't comprise the joint, they affect the joint, I should have said. But all of those working in conjunction with each other, if they're not working appropriately together, a physical therapist can help you decipher that and give you a course of action. This is also why people who go to the chiropractor are not seeing lasting results if they're just doing chiropractics solely. So I am not anti-chiro as a physical therapist. I'm not. I think that they do great things when they're a good chiropractor, just like any PT. The problem is that you also have to accompany that with movement and resistance training. So if you go to a chiropractor and you feel great after they work on your back or your neck, you need to be able to then go to another professional who can teach you how to load the appropriate muscles to protect those joints from deteriorating and impeding your function. That's where the important part comes in. So another thing is picking the right physical therapist. Especially with spine issues, you need to be consistently being loaded, and your program needs to progress as you progress. So you don't want to go to one of these mills where people are being seen, like 3 to 4 people an hour being seen by one therapist, because I can tell you, you are not going to be appropriately challenged and your program probably will not change. This is why a lot of people say like, oh, I've gone to physical therapy before and it just didn't work. And it's because they were not placed under appropriate stress, which you do need stress to get stronger. So that's another cautionary tale. Just kind of interview your physical therapy place before you decide to embark on PT. And my final thought on this issue, which I mentioned before, don't buy into the doomsday bullshit that if you don't get a surgery or an injection or whatever, regardless of how minimal the surgery is, if you don't get it now, you're going to get worse in the future. Nobody has a fucking crystal ball, including myself. You don't know what you're going to look like in 10, 20, 30 years down the line. It might eventually get worse. You might eventually have a neural problem or a nerve problem. You might eventually have a loss of balance, get weak, and lose your bowel and bladder functions, which are all extreme cases of stenosis if there is that nerve compression like we spoke about earlier. But it's not a guarantee. It's not. So why not do the things that you need to do, take the steps that you need to do conservatively first, and then fix yourself that way? Because you're only going to fix yourself. A professional is not going to fix you. We're going to give you the tools that you need to fix yourself, but your mindset and your brain have to be in that spot to want it bad enough to avoid things like surgery and avoid things like injections that just break down your body further and make that's the stuff that if you are a normal healthy person, those are the things that are going to push you to decline in function because complications can arise. It's just a fact. It's just what happens. So surgery costs money lines pockets, and there are people out there who just want to take advantage of you and put you under the knife for the sake of making them a buck. So it's not always in your best interest. Like I said, you always ask questions, always get a second opinion, especially if surgery is brought up. Most likely you need a second opinion if you go and the doctor hasn't even touched you and said you need surgery. I've heard that before, and it's very scary. So, I mean, in today's healthcare model, we really need to be aware of what to look out for. And I hate to be like the conspiracy theorist, but it's just a fact. Times are tough. Insurance reimbursements are declining. And the way people are seen in most places now is as a number and not as an actual individual. So just be aware of your options. Keep an open mind. Keep questioning. Keep educating yourself. And most importantly, stay fearless. We'll see you next week.